25-year-old female. She was found by her parents at home, vomiting and slightly confused. She was tachycardic to the 130s, so I put a 18-gauge angiocath in her right intube. Gave her 700 mLs of normal saline, 4 milligrams of ondansetron, and her parents are on their way.
Okay, great. Do you mind if I take a look at your run sheet? Okay. Amber, do you mind just putting her on the monitor and get me a first set of vitals? I'm going to start with the primary survey. Hey, how are you? Oh, okay. Okay. You know what? I'm going to do the primary survey right now. Oh, okay. Amber, let's get her 1 liter, get another bolus going, and give her 4 milligrams of ondansetron as well. You don't know what happened today?
Vitals are 150/80.
Okay.
Heart rate's 120.
Oh, wow.
Breathing
Real
20 times a
fast.
minute.
Okay. Do you have any medical problems?
No.
Do you have any allergies that you know of? Did you take any medication?
Temp is 37.6.
Okay. I'm going to go ahead with the secondary survey.
Second liter bolus is going.
Great. Does this hurt in your belly at all? Okay. Yeah, your skin's a little wet. Oh, okay. Are these scars here? Okay. I'm going to take a look at the pupils.
4 milligrams of ondansetron.
Great. Look at me. Look at my nose. All right, good. And do a complete blood count, a comprehensive metabolic profile. I think we should definitely do a serum ethanol level, venous blood gas with electrolytes, a point of care pregnancy test, and a urine analysis. Can I have you lean forward a little bit? Okay, go ahead, sit back.
Zone 1 trauma 4. Great. And the urine pregnancy test? Thank you. That was the lab. They were giving us critical values on the VVG. Her potassium is 2.7 and her pH is 6.9.
Wow, okay. Did they tell you what the PCO2 and the bicarbonate level is?
PCO2 is 30 and the bicarb is 7.
Wow, okay. With all that, can you please call them back and let's add on a lactate level, salicylate level, acetaminophen level, and the serum osmolarity level.
Dinah, are you okay? Doctor, I'm her sister.
Oh, great.
I just bought this bottle of aspirin last night and now it's empty.
This is a bottle of 325 milligrams aspirin and terra-coated, and there's supposed to be 300 tablets, but it's empty.
Oh, yeah.
Has she ever done anything like this before?
Well, she was in psychiatric ward before for trying to overdose, but
oh, wow.
she just had this periods in time when she's like really unhappy and
Okay, really important. When was the last time this bottle was full?
this morning, like 11 hours ago.
Hey doctor, she's not really responsive anymore.
Yeah, you know what? Okay, so why don't you, let's set up for intubation. If you could also escort the sister out. I'm going to have you step out, okay?
Oh, okay, sure.
Thank you.
Come with me. We've got a waiting room.
Ms. Smith?
RT's been paged. They're on their way down.
Great, great. Can you give me some medications? I'm going to need 20 milligrams of etomidate, 100 milligrams of succinylcholine. But before that, I'm going to need 100 MEQs of sodium bicarb, which is 2 amps, to be pushed right now before we start.
Right away.
Hi there, RT's here.
Oh, great. So I'm giving some supplemental nasal cannula. If you can help me get the ET tube, and if you can hold that, and set up the ventilator, because we're going to get started to intubate once the medications are pushed. And if you could please let me know what you're pushing and when.
Sodium bicarb is going in.
Okay?
Second amp is in.
Great.
Etomidate is in. Succinylcholine is in.
Okay. And we'll wait for the fasciculation. Okay, Amber, if you can just hold the bag, I'm gonna get. You have the ECU? Okay, take away the Amber bag. Alright. And scissor the mouth open. The cords, ET tube. Let's bag her. Okay, great. Now that we've intubated, let's talk about some ventilator settings. Let's give her a tidal volume of 8 cc's per kilo, which is 480 cc's. Let's do a respiratory rate of 30 to match what she was at before, and an FiO2 of 40% because she wasn't hypoxic. Amber, if you can also ensure that we get the post-intubation chest x-ray ordered and an ABG 10 minutes after that she's been on the ventilator. Thank you. Also, let's start a sodium bicarbonate infusion. Let's do 150 MEQs per hour in 1 liter of dextrose 5 water, which would be 3 amps in that liter. And we'll have that going at 150 ml per hour. Let's also start some potassium chloride riders, 10 MEQ per hour, and we'll recheck the potassium. We should do activate charcoal for the aspirin that she had ingested, and we can do that at 1 gram per kilo through the orogastric tube. Once that's done, let's give 1 liter of polyethylene glycol for a total of 5 liters, and then we'll reassess her throughout all of this.
Great. I'll get right on that.
Great.
Zone 1, trauma 4. Great. I'll let the doctor know. Thank you. That was the lab. They were reporting a critical value on the salicylate, 45 milligrams per deciliter.
Any other criticals?
Negative.
Okay, so then that means the acetaminophen was also negative, but that salicylate is really high. I need to call the intensivist, and we definitely have to arrange hemodialysis for her. Thank you for that critical. Yes, this is Dr. Joshi. I'm calling from the emergency department. I need to speak with Dr. Patel. Yes, hi, Dr. Patel. This is Dr. Joshi. I'm calling from the emergency department. I want to let you know about a 25-year-old woman I have down here. She's currently intubated. This is a woman who came in likely with an aspirin overdose. We estimate she took about 300 tablets of 325 milligrams of enteric-coated aspirin. Yeah, enteric-coated. We had to intubate her. She's very, very acidotic, hypokalemic. We have started a bicarbonate infusion. She's getting the potassium replaced. She's also getting activated charcoal. Once that's completed, we will start polyethylene glycol. I really think she needs to be in the ICU, and I strongly believe that she will probably need hemodialysis as well. Yeah, yes. Okay. Okay, thank you. We'll see you down here very soon.
Patient's restrained. I'm going to go check for x-ray.
Great, thank you.
Post-intubation pharmacy.
Oh, great. Okay, so it looks like the ET tube is in place, not in the esophagus, and I don't see any signs of pneumothorax. This looks great. Amber, the intensivist is on his way down. Why don't we, in the meantime, get an EKG? Let's do an abdominal x-ray. We might be able to see some aspirin tablets in there as well. And we need to get that arterial blood gas as well at this time.
All right, right away.
Thank you.
Doctor,
Yes.
will my sister be okay?
Well, your sister is critically ill and is going to have to be in the medical intensive care unit. Why don't we talk further about this, perhaps in the family room, okay? Come with me this way, and we'll talk.